Hey guys, it's Coach KJ, and I'm back. I'm back with Tatiana Smith, and she is a doula. She's a perinatal doula, so she works with women before the baby is born and also afterwards. And I wanted her to tell us a little bit more about how she got into the field, why she's doing it, and just some of the rewarding aspects of it, and just more stuff. So, Tatiana, thank you so much for joining me. I know that you've been doing this for 10 years, 10 full years. So you've got some great stories. Can you tell me a little bit more about how you got into this? I mean, for people who've, may have thought about it or may just want more information about using a doula.
Sure. So thank you so much for having me. Yes, I am a doula, a perinatal doula. I've been working in the metropolitan area of New York City for the past 10 years and looking to come to North Carolina. First of all, what a doula is someone who assists a family and a group of people that is supporting the laboring person in labor. They are not a medical provider. They are someone who provides childbirth educational support, and they help a person prepare for labor before and after. And they also offer support with miscarriage, abortion services, and anything related to perinatal health around infant and maternal health. So that is the first thing. Yeah.
So how did you get into it? Like what made you want to do something like this? I mean, this is huge. You're dealing with a life.
Yes. So I got into this because there was an organization in Newark called SPAN who
North
was doing
where?
an incubator. Newark, New Jersey.
Yeah.
So not Newark, Delaware, Newark, New Jersey. We They were offering a training for doulas, community doulas, and they were looking for Black and Brown doulas to support the community, and they were offering free trainings. So I took them up on their offer, and I did the trainings. I started supporting births in a number of different situations, and after that, I became certified with a few different organizations, notably Ancient Song Doula Services, Dona, and Uzazi Village. And I'm currently trained in all three, and I continue to offer support for those families in that area. And then we'll be offering it down here as well in North Carolina.
What is the most surprising thing about a doula? Like, why would somebody get a doula? And what did you, through this experience, say, like, wow, like a doula is a necessity, or a doula is really a great resource?
Well, I've supported many different families, not only, so me being a community doula, I focus primarily on Black and Brown communities and Black and Brown families, but I've supported a variety of different cultures. I've supported a Ukrainian and a Russian family at the same time at the beginning of the war. I've supported Arabic families. And so it's really meeting
So
families
we
where they
need you in
are.
world peace. We need you to go on and do a little part-time world peace with this. Talk to the babies.
The surprising part is that all families have specific needs when it comes to advocacy in the laboring room, and also with regards to perinatal health. All families do need that kind of understanding of their bodies and how to relate to their doctors in the medical space, and feeling empowered to ask the questions that help them to have a healthy delivery and also have a healthy life after they give birth. So that is one of the underlying currents that is contributing to the infant crisis, the infant mortality crisis in America. And that's one thing that a doula is really critical in helping with ACOG. So ACOG is an organization that has a lot of data around this. Doulas have been shown to reduce the infant and maternal mortality rate in the United States. Having a doula to support you is well known to be a positive aspect of the labor experience.
Wow. So have you ever dealt with a labor experience that had complications?
I have dealt with many labors that have had complications. I have dealt with stillbirths. I have dealt with families who knew that they were going to deliver a baby that was already deceased. least. And so there have been those complicated situations where you still want to dignify the birth, you still want to dignify the laboring person, but also work with the medical providers and the families to make sure that they are communicating well and they are having a positive, as much of a positive experience as they can. And then also they are receiving the proper medical care during the procedure and after, so that they feel fully supported and that they can continue their life on afterwards in a positive and healthy way.
So life on afterwards. You mentioned beforehand, or we were talking briefly about postpartum. And,
Yes.
usually we think postpartum, but, I've heard a year, last a year, couple of weeks, whatever, whatever. How long can postpartum last? Or how late can the onset be? Does it have to be 4 weeks, 3 weeks? Can it be 6 months, a year? Tell me a little bit more about what postpartum looks like.
Well, if you talk to any birth worker, a birth person in this space, we always say that postpartum is forever. So you after you have your baby, the postpartum can last your entire lifetime. But medically
Wow.
speaking, unfortunately, the typical sort of knowledge is 6 weeks is considered a postpartum. When you go to see your doctor at your 6 week checkup, that's usually like one of the few times that you'll see a doctor. And we know that families need to be supported at least a year after. That's why, with a lot of states that are delivering or offering doula support, they do offer up to a year of support services. We know that immediately after the birth, there could be complications such as hypertension and also postpartum psychosis. There is that can happen immediately after, but then those symptoms may not show up for a year or 2 years later, and they can show up in a variety of ways. There are different modalities of what postpartum depression looks like. It's not always sadness. Sometimes it could be hyperactivity. Sometimes it could be manic episodes. And so it's really critical to have someone that can identify those and also those symptoms, and also have a support system to where you can call out to people who can also identify that there's something wrong and make sure that you're able to get the proper medical care that you need to support you through that challenging time.
So it sounds like you can support the patient and the family members.
Yes, absolutely. So doulas, when we come in, a lot of times, especially in community doula care, when we're dealing with Black and Brown families, there is a lot of generational trauma that we're dealing with. And so, and sometimes when I'm meeting with families, it's not only the pregnant person that I am treating, but I'm also talking with mothers and grandmothers who have had negative birth effects or negative birth experiences, and sometimes they may relay information that may not be helpful, that may be traumatic in a way that doesn't help the currently present pregnant person get through. And so I try to break some of those negative thoughts around labor to create a positive experience, because we've seen that those type of negative thoughts and behaviors, they negatively impact the pregnant person. It can have a negative impact for how that person traverses through the perinatal period all the way through to the labor and delivery and postpartum. So there's something that we talk about called emotional dystocia. Penny Simkin, who is a world-renowned midwife, she is deceased, but she writes about in one of her books about emotional dystocia and its effect on labor and delivery and how it can negatively impact the birth. And so when we are talking with families, we want to make sure that that emotional dystocia is not carrying over into the pregnant person to where it could negatively impact their labor.
Wow. Wow. So I had always heard that you don't want to be stressed out while you're pregnant because those stressors can actually be passed down to the children. Most recently, postpartum has been brought to light a little bit more by celebrities who've experienced it, such as Brooke Shields. Well, she's not recent, but just got to mention that because I'm right around that age frame, right? But Brooke Shields, Chrissy Thigpen, Adele, Cardi B, people are speaking out more openly about postpartum depression and how to move forward. So uh, I can see many more conversations about that particular topic.
I think that one of the misnomers is that people assume that postpartum is immediate, only immediately after. There is the immediate after of postpartum, but it's really critical to understand that postpartum lasts several months to years after the baby is delivered, and there are symptoms that you need to continually look after. You're not healed right after, you go to your 6 week appointment. You actually need continual care and continual supervision. There are things that you need to look for after to see if there are symptoms such as the hypertension, the high blood pressure, the racing heart, the migraines. There are things that you need to look after for a period of time, for a few years, to make sure that you're not suffering unknowingly, and something that could lead to further complications. So this
Right.
is why we
And
say
even be
postpartum is not,
misdiagnosed. Being
yes, being
misdiagnosed is something else. You know what I mean? It could be uh, because we know postpartum is not the same as anxiety, but it could be misdiagnosed as anxiety or some other type of psychosis if you're not understanding what specifically that is. Now, postpartum or peripartum, it is in the DSM-5 though, right?
I have seen that. I just learned recently, like a couple of years ago, that it was officially entered. So that's something that I'm on learning about. But we've known about this as birth workers. We've known about this for years, that this is something that needs to be taken seriously, especially for postpartum moms and how they're treated, and some of the things that doctors should be looking out for, and some of the things that we need to help our clients and families advocate for once they have their baby.
The
We
supports.
need to bring those supports and bring it to light and make sure that it's properly accounted for.
Excellent. Tatiana, I feel so much smarter. My head's going to the left, lead to the left. All that brain power. Woo! Well, listen, I just thank you so much for the insight that you provided. I do want to follow up and ask you a few more questions in the future because, as people are moving into the era, uh, maybe not me. Maybe not me. Look, if it's me, it's gonna be another Esther. No, not Esther. What's her name? Sarah,
Naomi?
Sarah and
Oh,
Elizabeth, right?
Sarah,
That
yes.
was, yeah. When they were 80 years old having babies. But but yeah, I thank you so much for this. But like I said, as more and more people are having children and asking questions, and doulas become more visible and more popular, this insight is going to be powerful. I don't have the statistics right now, and usually I have some statistics, but I know that there's a very high rate of infant mortality, especially in minority communities, and there's also SCID, SID, which happens more regularly than we know about. But if it's captured early, then those symptoms can be reversed. I'm talking about in babies. Those symptoms can be reversed. But a lot of times we don't take the test, we don't check the immune system of the mom and the child to make sure that we put those precautionary measures in place. So as we talk more about immunology and therapy and doulas and all the other kind of stuff, I just would love to have you back and share more insight.
I would love that. It was great, really great talking with you. And I love sharing all the information that I have for families and advocating for them. So I really appreciate this
There goes
conversation.
that brain leading to the left. Let's lead to the left again. You are amazing, and thank you so much for everything. And we'll be talking soon.
Great. Looking
All
forward to
right.
it. All right then.
All right. I can't stop this recording. There we go.